The Ministry of Health is currently engaged in intense contact tracing efforts following the country's latest COVID-19 case, which was recorded on August 3rd as a departing passenger engaged in the required testing for travel. The discovery of this latest case, the 170th for Grenada, is quite unique, as it was not confirmed on arrival in the country, but as part of the departure process. The case, a female in her 20s, arrived in Grenada on Monday, July 26th from the United States with a negative PCR test. In accordance with the country's entry protocols, as a fully vaccinated person, she was tested on arrival, the result of which was also negative. Having been released from quarantine on July 27, based on the results of that test, the individual proceeded to visit a total of 10 locations between July 28th and August 3rd. Upon detection of the positive result following testing on August 3rd, the Ministry of Health verified the test result with a second test at another laboratory and immediately embarked on the requisite contact tracing effort. So far, only one contact has been isolated and tested, the results of which is not yet known. Case number 170 has reported experiencing congestion. Her identified contact, a family member, is also experiencing mild congestion. In light of this latest development, the Ministry of Health is encouraging the population to exercise extreme caution and to continue observing the recommended protocols: physical distancing, avoiding mass gatherings, wearing masks in public spaces, regular hand washing or sanitization of hands. Further, the Ministry of Health advises that persons who may be experiencing flu-like symptoms should isolate themselves and contact their nearest health facility. The Ministry of Health further reminds the population that the COVID-19 pandemic is a very fluid situation that requires constant vigilance. The country has fared well, but it is important to keep our guard up at all times. We have witnessed how rapidly the situation can change when the virus is present, oftentimes forcing countries to take stringent measures to protect their population. The more recent strains of the coronavirus, particularly the Delta variants, have been determined to be far more contagious and deadly. While this particular variant has not been identified in Grenada to date, it is known to be present in locations from where we receive visitors. Therefore, vigilance cannot be overemphasized. It is unfortunate that the news of this development comes at a time when the country is on the verge of celebrating what we hope will be Olympic gold. But we must urge caution as we celebrate the prowess of our athletes, a beacon of hope in very challenging times. We will not discourage celebration of this potential victory, but we encourage persons to do so with restraint and to observe the protocols. We cannot escape the fact that the virus is present and we must keep our guards up at all times. At present, we have only documented that one additional case, but circumstances create tremendous cause for concern, and we must all remain vigilant. Grenada currently has 4 active COVID-19 cases. As this is a rapidly unfolding situation, the Ministry of Health will continue to update the population within the coming days. Thank you.
The victory is coming all the way from Tokyo. Kirani James is heading for gold. We anticipate his victory. Our son will be bringing home the medal. Celebrate with care. Keep your social distance. And most of all, remember to wear your mask. Gold is precious, and so is life, especially in these times of COVID. Look out for fireworks in each parish as we salute the Jaguar. Kirani James, celebrate responsibly. Wear your mask. A message from the Ministry of Health and the Government of Grenada.